first thing you should know is an organ transplant is different for different people. But there are a few things everybody needs to know. Because every person who needs an organ transplant will go through many of the same steps. But before we talk about the process, let's take a look at the main organs that can be transplanted. The most common is the kidney, followed by the liver, heart, lung, pancreas, and the intestines. Now, you may already be wondering about how and when you'll get your new organ, but there's really no easy answer. A lot depends on which organ you need, where you live, and your specific health problems. Also, there are two different types of donors. In many cases, the transplanted organ comes from somebody who recently died. This is called a deceased donor. But for kidney or liver donation, many people use a living donor. And a living donor is a healthy person who volunteers to donate their organ or part of their organ to you. It may be a relative, a friend, or even a complete stranger. But no matter who the donor is, an evaluation is always the first step for anyone who needs an organ transplant. Okay, as you may already know, the evaluation is a two-stage process. First, you'll visit the transplant center and meet all the members of your transplant team. And then you'll go through a series of tests. This is to figure out if you are a good candidate for an organ transplant. After this, you'll find out whether or not you'll be added to the national waiting list. This is a list of people who need new organs and key details about those people. And just so you know, it's only for patients waiting for organs from deceased donors. Now, some people say that evaluation is one of the hardest steps. Because not every patient going in for an evaluation will make it onto the waiting list. But this step is the only way to know if you are a good candidate for an organ transplant. Now, evaluation is an ongoing process, and at times it can start to feel really long. There's no set time limit. From the first step, it can be weeks or months before you hear about whether you're a good candidate. You see, evaluation begins when your doctor decides that an organ transplant is an option for you and sends you to a transplant center. And it continues until you're placed on the waiting list, which can take anywhere from a few days to a year or more. But remember, you won't go through this alone. Your family and friends can provide a lot of really great support. And you'll also have the transplant team to help you through every step. These are the people who will be with you through this entire process. And you'll meet your team the first time you go to the transplant center. First, there's the transplant coordinator, who will be your main contact person at the transplant center. He or she works with you and other members of your team to coordinate your care throughout the entire transplant process. The transplant surgeon is the doctor who performs your surgery. There's the transplant physician. This could be a kidney, liver, heart, or other specialist, and he or she will help determine your need for transplantation and keep track of your regular care. And a financial coordinator helps you figure out how you can best afford the cost of your transplant and medications. If a social worker is part of your team, you can turn to them for help understanding and dealing with any basic health problems, social issues, problems at work, or financial trouble that might be caused by your illness. And a dietitian can help you create a nutrition therapy plan for before and after transplantation. This diet plan can help you maintain a healthy weight, reduce the side effects of medications that everyone has to take after transplant surgery, and improve the results of an organ transplant. Also, a psychiatrist can work with you to deal with any anxiety, stress, depression, or other psychological issues. These feelings are really common, so if you ever feel like you want to talk with someone, the help is there for you. Now, like I said, those are the people who usually make up a transplant team. But depending on where you live and which organ you need, there may be small differences. You'll learn about the details of your situation when you first meet with the transplant coordinator. Okay, for most people, that first visit can take a whole day. Why is this? Well, as you've just seen, there are a lot of people to meet. But there are also a lot of small steps that are needed to get a transplant evaluation underway. For example, some patients need several tests done for the evaluation to be complete. Now, not all patients will get the same tests, and you may need other tests later on. So I'm going to mention a few tests now. But if you want to know more about which tests you'll need, ask your doctor. One of the first tests you may get is a blood test. This is to find out what blood type you are. And you may also have a second blood test to help match donor tissue. And they'll also look for any viruses or infectious diseases like hepatitis or HIV. Next, you may have some other tests to help determine how healthy you are and how well your body might do with an organ transplant. Remember, this is major surgery. So you might get an electrocardiogram, EKG, echocardiogram, or a stress test. Imaging tests such as an X-ray, MRI, CT scan, ultrasound, or sonogram. And you may also need a colonoscopy, even if you've had one before. Okay, if you have diabetes, then you may also need to have some tests to see how healthy your heart is, and special tests to check the blood flow in your legs. Now, if you're a woman, you may also need a mammogram and a pap smear. And men who are age 45 and older may need to get something called a prostate-specific antigen, or PSA test. Once the tests are finished, the transplant team will go over the results and determine whether or not you're a good candidate for transplant. Now, reaching this decision is not easy. And as I said before, it may take your transplant team several months to decide. But if you are a good candidate for an organ transplant, then you'll be placed on the national waiting list. However, if the team decides that you're not a good candidate, there are other treatment options that may be available. Your doctor will talk with you about these options if needed. And of course, if you know someone who wants to try being a living donor for you, talk with your coordinator during the first visit. This way, the potential donor can be evaluated as soon as possible. Alright, let's talk a little more about the waiting list. Its full name is the Organ Procurement and Transplantation Network, or OPTN, and it's run by the United Network for Organ Sharing, also called UNOS. Over the course of a transplant, you'll hear a lot about these two groups. Now, you should know that the waiting list experience can be very different for patients needing kidneys, livers, hearts, or lungs. There isn't one set of rules for how organs are made available. But if you are placed on the waiting list, there are a few different things that get taken into consideration. For example, how sick you are, how long you've been waiting, your location, that is, how close you live to a potential donor, and body size and blood type. In other words, will the donor's organ fit your body and match your blood type? Now, no matter which organ you need, your name does not necessarily have to be first on the list to get a new organ. You just have to be the best match. This means once you've been placed on the list, an organ may become ready for you at any time. Of course, waiting for that call can take a long time. As I said, it can be weeks, months, or even years before an organ is available for you. But once you get the call, you need to be ready to go, both mentally and physically. Of course, being on the waiting list is a serious commitment for you and your family. And you need to take good care of yourself so your body is ready for a transplant at any time. Here, let's talk about what it takes to be ready. First, let the transplant center know about any changes in your condition. If you have to go to the hospital, make sure you or your caregiver tells the transplant coordinator immediately. Also, keep your prescriptions filled and take all of your medicines. And if your prescriptions change at any time, let your transplant coordinator know. Okay, this one is really important. Do not miss any appointments you have with your doctors or members of your transplant team. If you think you need to miss an appointment, make sure you call ahead of time and reschedule. because if you start to skip appointments or if you don't keep up with your medications, then you can be taken off the waiting list. And to get back on it, you'd need to start all over again. So make sure you're doing everything you can. Now, there are some other things you can do to make this go a lot more smoothly. Because, as you know, waiting isn't easy. So you might think about joining a support group. Talk with the social worker at the transplant center about support groups in your area. Okay, you might not think of yourself as the support group type, but being in a support group can be a really valuable way to get more information and talk openly with others who understand what you're going through. And of course, keep eating healthy and make sure you exercise regularly if your doctor says it's okay. You can work with a dietitian and physical therapist to create a plan that works well for you. And stay as active as you can. Really try to be positive and continue living your life. If you feel up to it, keep going to work, studying, visiting with family and friends, and doing any hobbies that you enjoy. Find different ways to relax and take your mind off waiting for the transplant. Reading, listening to music, and meditation or yoga can all help clear your mind. Also, you want to be available and prepared for your transplant. So, the transplant center may want you to have a pager, beeper, or cell phone so they can reach you immediately. And think about packing your bags ahead of time so you can be ready to go at a moment's notice. Make sure there's somebody available to give you a ride at all times so you can get to the center as soon as possible. Also, you won't be able to drive yourself home after surgery, so try and set up your rides to and from the hospital before you get the call. That way, you won't have to worry about them later. Okay, when a matching organ becomes available, the transplant center will alert you immediately. You see, when an organ is ready, surgery needs to be done in less than 24 hours. That's why it's so important for you to be ready and available at all times. Now, the details of surgery are different for each organ, but some things apply to everyone. For example, some medications can increase the risk of bleeding or blood clots. So, for your safety, make a list of everything you take, and this includes all prescription medications, any other medicine, like aspirin, Advil, or Motrin. Herbal supplements, like echinacea or ginkgo biloba. Vitamins. And recreational drugs. And if you take a blood-thinning drug like warfarin, also called Coumadin, or a drug called Plavix, make sure the transplant center knows about this. It's also important to let them know if you take medication now for conditions like high blood pressure or diabetes. Now, you'll probably get instructions telling you what to do once you get the phone call. One thing you may hear about is eating and drinking. The transplant center may tell you not to eat or drink anything after you get the call for surgery. Why? Well, if there's anything in your stomach and you throw up during the procedure, it can be very dangerous. So make sure your stomach is empty, or your surgery may need to be rescheduled. That said, if your surgeon tells you it's okay to take some or all of your regular medications before surgery, just take them with a sip of water. Your surgeon will have a specific plan for your operation and recovery, but I'll give you a general sense of how it will go. Before the operation begins, an IV will be placed in your hand or your arm. This is so you can receive antibiotics, medication, and fluids. Then you'll be connected to monitors that measure your blood pressure, heart rate, and the amount of oxygen in your blood. You may also have compression boots to help lower the risk of blood clots in your legs. Then they'll start the anesthesia. Organ transplant surgery is usually done under general anesthesia, which puts you into a deep sleep. First, the anesthesia provider will place an oxygen mask over your mouth and nose and ask you to take deep breaths. Then you'll get the anesthesia through your IV. The medication may sting or burn a little bit when it goes in, but don't worry, that's normal. Very quickly you'll fall asleep. After this, you really won't remember anything about the procedure. Now, once you're asleep, you'll most likely get antibiotics through your IV to reduce the chance of infections. And they'll place a tube in your mouth and down your windpipe to help you breathe. Don't worry, you won't feel the tube going in, but when you wake up, your throat may feel a little sore. And another soft tube may be placed in your bladder. And when everything's ready, the transplant surgery can begin. If you want to know more about the specifics of your organ transplant, talk with your transplant coordinator. Okay, now, recovery is different for different people. After transplant surgery, many people will spend some time in the intensive care unit, called the ICU. And patients with heart, lung, or liver transplants may also need to be on a breathing machine. But as soon as your doctor thinks you're ready, you'll go home. Just make sure you have someone to drive you. Don't even think about driving for several weeks after surgery. It's just not safe. Now, as you may know, an organ transplant doesn't end with surgery. You'll have to keep taking really good care of your body. And this includes taking care of your immune system. Let me explain. Your immune system naturally tries to get rid of anything that doesn't belong in your body, like a virus. And it doesn't know what this new organ is, so it treats it like something that may harm you. To help with this, you'll need to take anti-rejection drugs, so your body can adjust to the new organ. These anti-rejection drugs, also called immunosuppressants, weaken your immune system so it won't attack the new organ. Now, of course, a weak immune system can be a bad thing, so you may need other medications to help protect you from germs, infections, and viruses. Even common colds or the flu may hit you harder than usual. So, it will be really important to continue your regular doctor visits so they can track your progress. Also, you'll want to keep your prescriptions filled and make sure you're taking all of your medications. There are, of course, two main benefits to organ transplant surgery. The first is that your new organ can help you live longer. And second, your quality of life can improve, so you can feel better and live a fuller life. But like any surgery, there are some risks. And it's important to understand everything that's involved. So if you have any questions about how these risks relate to you, please ask your surgeon. And while I'll go over 8 risks here, there are some very unusual risks that will not be covered. So please do not consider this list complete. Okay, let's begin. There is a risk your body will reject the new organ. If this happens, you may need to take more medication, or the organ may need to be removed. If possible, you may be able to get another transplant. It's possible that your body will reject the new organ. This means that your body's natural immune system may attack the new organ. As I explained earlier, to keep your body from rejecting the transplanted organ, you will need to take immunosuppressants. If needed, your doctor can also prescribe other medication to help protect your new organ. But in rare cases, the transplanted organ may need to be removed. If possible, it can be replaced with a new organ. If this happens, you will need to go through the evaluation process again to qualify for another transplant. During surgery, there is a risk of injury to other nearby organs. For example, if you're having a kidney transplant, there is a risk of injury to the liver or intestines. If this happens, another operation may be needed to repair any injuries. While injury to the surrounding organs is rare, if an injury does happen, it can be serious. An injury can lead to a severe infection, a lot of bleeding, long-term problems with your liver, or problems going to the bathroom. If there is any kind of injury, more surgery may be needed. There is a risk of infection. In rare cases, more surgery may be needed to treat an infection. Although your surgeon will take great care to prevent it, you may get an infection in the area surgery was done, or in other parts of your body, like in your lungs or bladder. Signs of infection include redness, swelling, fluid draining from the area surgery was done, pain that gets worse, or a high fever or chills. If you feel any of these things, call your surgeon right away. Most of the time, antibiotics alone can get rid of an infection, but in some cases, you may need to be admitted to the hospital for surgery or other treatments. While it's rare, there is a risk that after a blood transfusion or an organ transplant, you may get a disease, develop a cancer, or have other health problems. Although banked blood and donor organs are checked to make sure they are clean and free of disease, there is still an extremely small chance that you could get a virus, like hepatitis or HIV. There is also an extremely small risk you may develop some kind of cancer in the donor organ, or the new organ may already be carrying a cancer. If you have any questions about the risks of blood transfusion and donor organs, talk with your doctor. There is a risk of blood clots that, in rare cases, can be life-threatening. Blood clots can form in your blood vessels during or after surgery, and in rare cases, a blood clot can travel to the heart or lungs. This can be very dangerous and can even be life-threatening. Signs of blood clots include sudden shortness of breath, severe chest pain, or pain, redness, or swelling in one or both of your legs. If you have any of these signs, call your surgeon or get emergency help right away. There is a risk of bleeding both during and after surgery. If there's bleeding after surgery, you may need to go back into the hospital to treat it. As with any surgery, there is a risk of bleeding during and after the operation, and in most cases, your doctor will be able to control it during the operation. But in very rare cases, you may experience bleeding in the days afterward. If this happens, there's a chance you may need to go back into the hospital for more treatment. There is a risk of bad or allergic reactions to the anesthesia, medications, or materials that are used. While it's very rare, you can die from a serious reaction. An allergic reaction happens when your body tries to get rid of something it doesn't want, and it's your body's response that can be serious. Signs can include dizziness, throwing up, swelling, a rash, or trouble breathing. Your healthcare team is trained and ready to respond to allergic reactions, but in rare cases, people can die. If you've ever had an allergic reaction or know you're allergic to any drugs, foods, or materials like latex, please let your doctors know. And let them know if you or anyone in your family has ever had a serious reaction to anesthesia. There is a risk of a stroke, heart attack, organ failure, or death. How your body handles surgery depends on what kind of condition your body is in. Some bodies are stronger and can handle surgery better than others. Age, illnesses, heart conditions, past strokes, and other things like being very overweight may make it harder to perform surgery successfully. It is possible you could have a stroke or a heart attack during surgery or as you recover. These attacks can be mild or severe. Although the risk of death is small, you may die during surgery or the recovery period from any of the risks I mentioned earlier, or for other reasons. Now, there are some alternatives to transplants. Of course, one alternative is not to have the transplant, and it's important for you to know you have the right to refuse a transplant up until the time you're going into the operating room. If for any reason you're not comfortable with the transplant, talk to the coordinator about your options, because there are other treatments available. Now, these are different for each organ, and they may also be different depending on your illness. For example, if you need a kidney transplant, you may have the option of hemodialysis or peritoneal dialysis. If you're waiting for a heart transplant, you might think about using an artificial heart, something called a ventricular assist device or a pacemaker. And if you're waiting for a pancreas transplant, you may be able to keep using insulin or an insulin pump. But you're watching this because your doctor thinks a transplant may be an option for you. Of course, the transplant process can be difficult, long, and challenging. and it requires a major commitment from you and your family. But, as I said earlier, your transplant team is there to help you. So you won't go through this alone. And if you can see it through, a transplanted organ can be a new lease on life.
Hi, my name is Seigo Nishida. I'm a surgeon of the liver transplantation. I would like to explain about the liver transplant. First, as a formality, I go paperwork. National average of 1 year graft survival 92%. Our result is better, 92.41%. National average patient survival is 93.8%. Our result is better, 94.76%. This is SRTR, Scientific Registry of Transplant Recipient. It will release every 6 months. This is the most updated data. Thank you. And next, I would like to discuss about this informations. Indication of liver transplant is end-stage liver disease or metabolic disease or liver tumors. And then allocation of the liver is based on UNOS allocations. UNOS allocation based on MERD scores. MERD score is, depending on your blood test, bilirubin, creatinine, INR, sodium. These 4 numbers you put to the formula, and the formula will generate your point. 40 is the highest, 6 is the lowest. And higher the point, higher on the wait list. And next, I want to talk about what you expect. Transplant surgery takes 6 hours. Some are shorter, some are longer. And in a few days, you will stay ICU after the surgery, and then 5 to 7 days on the floor. Generally speaking, 7 to 10 days you will stay in the hospital. Some are shorter, some are longer. And then, after discharge, you will follow in the clinic. We will do blood work in the clinic. We will follow. And also, in 3 months, you will feel better. Most of the patients recover very well. You will have a life without liver problem. After 3 months, most of the people back to work and spend a good quality of life. And next, I want to talk about the surgery. Incision, we do the midline and bilateral incision. Surgery is similar to changing the battery of the car. Open, disconnect, remove, put it in, connect again, and close. We will put a drain in the abdomen to check the fluid, check the bleeding, and the drain stay about 5 days, and some are shorter, some are longer, depending on the conditions. And the liver comes with a gallbladder. We will remove the gallbladder. And liver comes with gallbladder. There is no negative impact to removing the gallbladder. And also, if there is a gap, we use donor vessel to fill the gap. And this is a drawing. Hepatic vein, portal vein, artery, and bile duct will connect. And next, I want to talk about complications. Certain complications I need to tell you. One is primary non-functioning. If you change the battery should work. But if you take a battery from the car in the parking garage, one of them might not work. Similarly, after liver transplant, some liver doesn't work like we want to. If it's happened, we will change the liver again. And also, if anything wrong, we are going back to the operating room, we call second look. Sometimes we don't close, and we close later intentionally. Other time we close. If there is any doubt, we go back to the operating room, we'll open and we'll check. This is for safety. And liver transplant can be done with a transfusion. However, most of the time, there is a blood transfusion is necessary for safety. And also, there is a risk of blood clot. If blood clot happen to the heart attack. If blood clot happen to the brain, it's a stroke. Blood clot can happen to the liver, hepatic artery thrombosis. If it happens, we use medication, we use the cath, balloon, stent. If necessary, we do a surgery. If necessary, we change the liver again. Same thing can happen to portal vein, hepatic vein. Also, there is a risk of biliary complications, strictures, leak. Because of the size is different, everybody has a different size, sometimes leaks, sometimes strictures. If it happens, we do interventions, we put a stent, we put a balloon, we put a needle to drain. If it doesn't work, sometimes back to surgery, we connect again. And after transplant, there is a risk of rejections. Your body can reject the organ. Vice versa, your new liver can reject your bodies. If it happens, we use medications. And if your liver rejects your body, we call graft versus host disease, GVHD. And there was a two virus infection. Is infamous. One was Epstein-Barr virus infection. It can cause lymphoma. The other is cytomegalovirus infection. It can cause pneumonitis, retinitis, colitis, pneumonia. For that reason, we use medication after the transplant to prevent those virus infections. 3 months to 6 months, depending on the condition, we use those medications. And this day, there is a risk of COVID-19, coronavirus infections. To prevent those things, social distance, wash your hand with soap, avoid the crowded places, wear the mask. We don't have a treatment yet, so those precaution is very important after the transplant and also before the transplant. There is a risk of recurrence of native liver disease. It can happen, and there is a very low chance, very low risk. And also, generally speaking, everybody have a risk of cancer in their life. After the transplant, there is a risk of cancer from your body. Also, there is a risk from cancer from the transplanted organ. So regular checkup is very important, and slight increased chance of cancer is there. And also, we discussed about the SRTR data. It will update it every 6 months. Next, I would like to discuss about donors, which include IV drug users, inmate, jail time, and other social behaviors. If those things are happening, we will disclose the information and we will discuss with you. We will check all kind of studies as much as we can. If medically it's a good donor, we'll recommend you to consider. If there is a problem, we don't even contact you. And if you say no, there is no penalty. You will get next offers. You are the one to driving the car. Next is we call extended criteria donors. Age over 65, slightly obese, fat in the liver, previous history of hepatitis B exposure but not infected. We call hepatitis B E core antibody positive, hepatitis B core antibody positive donors, and also exposure to parasite such as Chagas disease. And split livers, small liver go to the other people, large liver go to the larger people, can be used. And the others, prolonged cold ischemic time, still can be used safely, but there is a certain risk. And also donor from brain tumors can be used, but there is a risk. If those things are happening, we will disclose the information. If we don't hear from any other disclosure, regular standard donors. And next, I would like to discuss about donation after cardiac death. Some family member want to donate an organ, however, they want to stay up until last minute, until heart stop. After that, somebody come, declare the death, family leave, we procure the organ. There was a downtime, very long downtime, we don't use it. Short downtime can be used. About 10% increased chance of complications, such as non-functioning and biliary complications. Next is a living donor liver transplant. From healthy donor, half of the liver we take and transplant to the recipient. Can be done, especially relatively low MERS score, but need a liver, those are the best candidate. And then hepatitis C positive donors. Hepatitis C positive organs can be used safely with cautions. Before 2014, we did not use those offers. However, there is a medication available. About 2 months, you take medications, 98% of the hepatitis C cure. So can be used those offers. If there's a young donor with hepatitis C positive, after the transplant, those organs can be used. Those if you take medications. And some cases, we don't even need to take medications. And there is a system ask you to, do you consider the offer from the hepatitis C organs? If you say no, offer bypass you. If you say yes, offer come to you, we can discuss. You can say no, there is no penalty. If there is a good organ, if you decided to use it, it will save your life. And I would like to discuss about coronavirus. We don't have a treatment of coronavirus, so we have some recommendation. First, wash hand a lot with soap. Wear the mask all the time. Keep 6 feet distance all the time, even at home. Don't go out unnecessarily. Minimize to go out. Stay at home. And if possible, separate room, separate bathroom. Do not share. If you touch the surface, there might be a virus, but usually it does not infect you. However, if you touch your nose, eyes, ears, virus can infect you. So don't dig your nose, don't touch your ears, don't touch your eyes, don't put your finger to your mouth, and that's very important. And also, don't allow any sick people around you. Even the grandchildren or visitor, family member, do not allow them to around you when they are sick. Please wear the mask, even in the hospital. When you're going to anywhere in the hospital, always wear the mask. Take shower with soap every day if you can. And also, we do telemedicines in order to minimize infection of the coronavirus. We start using telemedicines. Please sign the consent for telemedicine. And if you have any questions, please contact us. We are more than happy to answer your question. I hope you understand the liver transplantation. Thank you very much.